It's my great pleasure to join this joint session with GWACC, with ACC. And I will give the presentation on the gaps and solution on the quality of management of heart failure in China. The first, let me to give a brief introduction for the current status of heart failure. The data source came from the HQMS system, and that is the National Heart Failure Data Source, and from the Hospital Quality Monitoring System. And we just include the patients diagnosed as heart failure for adult heart failure patients from 2022 to 2023. So the total number for hospitalized heart failure patients in the last year, the number is over 14 million patients for hospitalized heart failure patients, which to accounting for 1/5 of the total number of hospitalized cardiovascular disease. So that shows there is a great burden for heart failure patients, especially for the hospitalized heart failure patients. And the average mortality of in-hospital and also include non-medical discharge rate for hospitalized heart failure in last 2 years. The average rate is about 10%. And the Thursday readmission rate for hospitalized heart failure patients across the different levels of hospital nationwide, that shows in the tertiary hospital, the 30 days re-hospitalization rate is nearly 11%. And heart failure had a lot of comorbidities, and the number of heart failure patients increased with age. The largest proportion of heart failure patients are between the age of 85 to 74, and the patient over 65 years old accounted for about 74%. And the comorbidity for heart failure, that shows nearly 30% of heart failure patients have coronary heart disease, and nearly 30% have hypertension. For other comorbidity, such as COPD, stroke, and diabetes, is about nearly 1/3. And the clinical assessment rate for heart failure needs to be further improved. That we just get the data that shows for the precise heart failure heart function classification diagnosis, that is nearly less than 70%. And for the patients combined with AMI, and the CALIP classification diagnosis rate is less than 50%. And for the diagnosis index, such as the NT-proBNP or echo, the test rate is not very so high. So the average rate is less than 50% in last 2 years. And the more low rate for the X-ray or ECG assessment at the admission time for heart failure is also about 25% and 60%. So that shows we need to improve the precise and correct diagnosis for heart failure. And for the GDMT treatment rate, it is also improved compared with the last several years, but the average GDMT medication rate is about 70 to 80% for the RAS inhibitor or beta blocker or MRA. And the trend for SGLT2 inhibitor use rate is increased in recent several years, and its benefit from the medical insurance system in China and compared with the data from the GATWIS guideline from the American that shows the GDMT, the total GDMT rate is lower than the GATWIS guideline data, but the SGLT2 inhibitor is higher than the use rate in Western countries. So in the future, we need to improve the GDMT treatment for heart failure patients in China, especially for the target dosage rate is not so high. And for the device therapy, the total number for the device therapy is relatively low in heart failure patients in China, including the CRT or ICD or others such as ECMO or LBP. Also the intravenous immersive hemodynamic monitoring rate. But we need to focus on the such as class 1 recommendation for the device therapy. For example, for the CRT treatment, the percentage for the class 1 recommendation, it is only nearly 70%. So we need to improve the device number for treatment of heart failure. We need more to emphasize for the quality and the correct recommendation for the device therapy in heart failure patients. The next part is talk about how to improve the quality control and management of heart failure in China. That is some measures that we have do some work in the past several years. First, we published together with all of the experts on heart failure in China, and to publish the guidelines or consensus on heart failure and related disease. We published nearly more than 30 papers on heart failure. All of these papers just focus on heart failure and its related disease, and that give the guideline recommendation for the diagnosis and treatment of heart failure in China. Most of them are similar with the AHA or ACC or ESC guideline, but we add the experience and concept of China heart failure experts. And that is some flowchart or recommendation in China heart failure guideline. This is the classification and the stage and type of heart failure, and we add the subsequent assessment and reclassification for heart failure. That shows the heart failure need a recurrent evaluation during the treatment period, and that is the flowchart for the treatment of HFrEF patients. And we just focus on the lifestyle and also the volume control, and also give the recommendation according different type of heart failure, divided to the HFrEF, MRF, and PAF patients. And that is the diagnosis and treatment flowchart for the HFpAF. And that is the management flowchart for the acute heart failure. And we just focus on the specific comorbidity treatment. We use the CHAMP React to delegate different types of comorbidity for the treatment of acute heart failure. And we also published the quality control system in China in 2020 years, and we just issued the index system of quality control of heart failure in China. And this year, we just will publish the renewed heart failure quality control standards and the system by the end of this month. So we just to renew the index according new recommendation from the guideline. So that is the criteria that we evaluate the quality control for the heart failure management. And the similar with the ESC quality indicators of heart failure. And the second measures, such as we set up the National Cardiovascular Disease Center of Heart Failure Specialist Medical Association, that is the Heart Failure Special Alliance. This organization is led by the National Center of Cardiovascular Disease, and it will to take some effect, such as the improve the heart failure medical quality control and quality improve, and also established some collaboration treatment network, and also to build the scientific research collaboration network. So all of this work will be to help to improve the management of heart failure. And for the advanced heart failure or some acute heart failure, and we also to set up the advanced heart failure center program, and to focus on the advanced heart failure and how to improve the device therapy, and how to improve the quality and reduce the mortality of the advanced heart failure. And the third is to initiate the National Heart Failure Medical Quality Control and Quality Improvement Program. And this is the issue that be published 2 years ago. We focused on the improve the quality control and quality improve program, such as set the nationwide heart failure specific quality control network, and focus on the quality control indicator standards, and to education the doctors to use well guideline in their real world clinical practice. And we also set up some heart failure centers, and also through the normalization, standardization, and recertification, and through this progress, and to help the different levels of hospital to set up the specific heart failure groups. And all of these data we just combined together, and to deliver the National Heart Failure Healthcare Quality Control and Improve report, and the data from the HQMS, and also some registry study. And the first part is to work together with the National Single Patient Care focused monitoring system, and to help to set up the heart failure part of medical national data system. And we also to select about 10 index, which is the key point for the quality control of heart failure, such as the test rate of NT-proBNP or echo, and the use rate of diuretic, and the use rate of GDMP, and also the device therapy. And the fourth is to stress the death of heart failure quality control, and that is documented on the how to improve the death-related heart failure. And we just set up the quality control group in different provinces, and to check some of the cases that caused by the heart failure, and also to set some the standardized format for discussing the death reason, and to evaluate the treatment, and to give the evaluation for the quality about the deaths came from the heart failure. And the last is the training specific doctor on heart failure. It is very important. We set the training program and use the different type of method, and to set the training context, including the basic theory or the new development, and also the such as a special case study, and put them together to format the heart failure specific training system. And we also give some training evaluation, and to certificate the specific heart failure doctors, and to push them to use well and learn well the guideline and other new research and some development of the heart failure. So we just make the conclusion for the project, that is we called 6-1 project, which we set up the 2 committees, and to set up a National Heart Failure Congress. And we named the November 26th as the National Heart Failure Day. And we also to leading the Journal of China Heart Failure and Cardiomyopathy. And through all of these projects, we hope to improve the quality of the management of heart failure in China. Thank you.